What if we could delay or even prevent type 1 diabetes before it fully develops? For decades, type 1 diabetes has been treated only after the immune system has already destroyed insulin-producing cells. But in 2026, new immune-modulating therapies are changing that timeline. Researchers are now exploring ways to intervene earlier, before permanent damage occurs. Type 1 diabetes is an autoimmune condition in which the immune system mistakenly attacks beta cells in the pancreas. These beta cells are responsible for producing insulin, the hormone that regulates blood sugar. When enough of these cells are destroyed, the body can no longer produce sufficient insulin. Patients then require lifelong insulin therapy to survive. Historically, treatment focused entirely on managing blood glucose levels after diagnosis. However, scientists now understand that the autoimmune process begins months or even years before symptoms appear. This early window has opened the door to preventive intervention strategies. Researchers are now studying how early immune signals and genetic risk markers can help identify individuals who may benefit from these early interventions. New therapies are designed to target the immune system itself rather than simply replacing insulin. These immune-modulating drugs aim to slow or interrupt the autoimmune attack on beta cells. By preserving even a portion of insulin-producing capacity, patients may maintain better metabolic control. Some therapies are being studied in individuals who test positive for diabetes-related autoantibodies, but have not yet developed clinical symptoms. Early clinical trials have shown that certain immune-targeted treatments can delay the onset of type 1 diabetes. This represents a fundamental shift from reactive treatment to proactive prevention. Instead of waiting for full disease progression, clinicians may soon intervene at the earliest detectable stage. Such early intervention strategies may help preserve pancreatic function for longer periods of time. The implications are especially significant for children and adolescents, who represent a large portion of new type 1 diabetes diagnoses. Delaying onset by even a few years could reduce long-term complications and improve quality of life. Preserving beta cell function may also decrease the risk of severe hypoglycemia and other metabolic instability. Families could gain valuable time before the need for full insulin dependence. Beyond individual patients, early intervention may reduce long-term healthcare costs associated with diabetes complications. These therapies also represent a new era of disease-modifying treatment in autoimmune disorders. By targeting immune pathways early, medicine is shifting from managing consequences to preventing damage. This prevention-focused model could influence strategies for other autoimmune diseases as well. While more research is still needed, immune-modulating therapy offers a glimpse into a future where type 1 diabetes may be delayed or potentially prevented. Screening programs to identify high-risk individuals are becoming increasingly important. The question is no longer just how to treat diabetes, but how to stop it before it starts. In the coming years, prevention may become one of the tools in endocrine medicine,